Welcome to our video about aspergillosis and what you need to know about it. What is aspergillosis? This article will help you understand what aspergillosis is and how it is spread. This condition affects the lungs, but it can affect other organs, including the brain, heart, and intestines. People with immune system problems, transplants, high-dose steroids, and chemotherapy are susceptible to this disease. Treatment for ABPA can include an antifungal drug. A chest X-ray is required to diagnose the condition. About aspergillosis. Unlike some other infectious diseases, aspergillosis rarely develops in healthy individuals. In fact, most people breathe in the fungus every day, and many people don't even realize they are infected. People with weakened immune systems or underlying medical conditions are more likely to develop an infection from Aspergillus. People who have low neutrophil levels or are on immunosuppressive drugs are particularly susceptible. Symptoms of Aspergillus infections can vary depending on the location of the infection. Treatments include antifungal medications. However, some types of Aspergillus are resistant to these drugs, increasing the risk of recurrence. In severe cases, aspergillomas may need surgical removal. In order to prevent aspergillosis, patients should correct any condition that may weaken their immune system. Fungal cultures can help diagnose aspergillosis. During a fungal culture, a sample of the affected tissue is sent to a lab. The organism grows in the culture. A positive culture will tell if a patient has aspergillosis or another fungal infection. It will also help determine whether an antifungal medication will work. Occasionally, a fungal culture can miss a diagnosis altogether, so it's always best to consult a doctor and get a second opinion. If the fungal infection is severe, patients may experience fever, chills, and coughing up sputum. They may also experience an unintended loss of weight and experience rales and dermatologic changes. Although the symptoms of aspergillosis are different, the common symptoms include a stuffy nose, coughing up blood, and shortness of breath. When it's severe, the affected person may also experience pain and fever. Aspergillosis symptoms. The symptoms of aspergillosis are similar to those of many other illnesses and infections. The fungus can spread rapidly to multiple organs and cause many different symptoms. For example, aspergillosis can cause partial or intermittent blindness. The fungus can also cause facial swelling. As it spreads to the brain, it can damage the optic nerve, resulting in neuron damage and symptoms that mimic a stroke. For these reasons, aspergillosis symptoms must be closely monitored by a doctor to rule out other underlying illnesses. Aspergillosis symptoms vary from person to person. They include coughing up mucus, blood, and symptoms that resemble a mild asthma attack. People with the infection may also experience unintended weight loss. Aspergillosis is best diagnosed by a physician if the symptoms become severe or persist for a long time. Aspergillosis is a serious infection and requires immediate treatment. Treatment for aspergillosis consists of medications that suppress the immune system. Inhaled steroids are ineffective for treating this condition. Patients with weakened immune systems should consult a healthcare provider as soon as possible. If the aspergillosis is invasive, antifungal medications can be prescribed before the condition develops. Because aspergillosis is caused by Aspergillus mold, it is almost inevitable for people to come into contact with it. People may have come into contact with Aspergillus mold from grain crops, compost, and decaying leaves. Risk and prevention of aspergillosis. Aspergillosis can be contracted by being exposed to mold spores. Healthy people rarely have a problem with daily exposure because their immune systems destroy mold spores on contact. However, those with weakened immune systems, including those who are immunosuppressed, may be at higher risk for developing invasive aspergillosis. Invasive aspergillosis can lead to life-threatening conditions, including kidney failure and breathing difficulties. Invasive aspergillosis occurs when the infection travels from the lung to the bloodstream. The infection can spread to other organs and may be fatal if untreated. People with weakened immune systems are at greater risk of developing invasive aspergillosis, which is more severe than the more common forms of the infection. Low white blood cell counts, long-term use of corticosteroids, and hospitalization are all risk factors. The risk of invasive aspergillosis is highest among patients in intensive care and those with chronic lung diseases. Several protective measures are recommended for these patients. Environmental dust control and prevention of airborne spores are also effective preventive measures. Antifungal drugs, meanwhile, can help prevent nosocomial aspergillosis. There is a need to assess the severity of aspergillosis outbreaks. Aspergillosis is most common among people with weakened immune systems and underlying diseases. People with poor immune systems and chronic lung problems are at a higher risk of infection. People taking antibiotics or immunosuppressive drugs are at an increased risk of aspergillosis. They should be aware that there are several types of aspergillosis and how to treat them. How aspergillosis spreads. Aspergillus fumigatus primarily spreads through the inhalation of fungal spores. These spores, called conidia, are present in the environment at all times, and people continuously breathe in these spores. While this continual exposure to the fungus is typically harmless, it can cause infection if a person's respiratory tract is weakened or immunosuppressed. Infection with aspergillosis is extremely rare in healthy people. But the majority of people breathe in the spores on a daily basis. People with underlying conditions and weakened immune systems are at a much higher risk of contracting the fungus. Other risk factors include low neutrophil counts or the use of immunosuppressive drugs. In addition to exposure to Aspergillus spores, infection with aspergillosis can be fatal. Prevention is the key to limiting the risk of developing aspergillosis. Avoiding exposure to areas with excessive dust and soil is a key way to protect yourself and your family from infection. Wear long pants and shirts when working in a dusty environment, and use gloves whenever handling soil. It's essential to stay away from areas with high levels of soil, as this can be a breeding ground for Aspergillomas. The symptoms of aspergillosis are often reminiscent of other diseases. To rule out other causes, a doctor may recommend a skin biopsy or a blood test. Both blood tests can help diagnose the disease. In cases where Aspergillus is suspected, a patient's body may respond well to treatment with an antifungal drug. To treat the disease, patients may be treated with prednisone to suppress the immune system. Aspergillosis diagnosis. The diagnosis of aspergillosis begins with a medical history and a risk factors. Your healthcare provider will also consider symptoms and recommend treatment options. Depending on where the infection is located, your healthcare provider may recommend imaging tests. He or she may also perform a tissue biopsy. A small piece of affected tissue is taken for analysis to determine if Aspergillus is present. Aspergillosis diagnosis may be difficult, but it is possible with the right testing. CPA is usually present in patients who are middle-aged and male. Clinical symptoms include chest discomfort and chronic productive cough. Hemoptysis is an indication of Aspergilloma. Radiological findings include a pulmonary cavity with and without an Aspergilloma and varying degrees of fibrosis. Aspergillus-specific IgG is a crucial diagnostic test. PCR and biopsy/aspiration are also useful for CPA diagnosis. Genetics, autoimmune conditions, and immunosuppression may influence the host response to Aspergillus. Invasive aspergillosis is a life-threatening disease affecting immunocompromised individuals. It can be diagnosed by the detection of Aspergillus IgG antibodies, but the identification of an antigen is more important in cases of invasive aspergillosis. Aspergillus bronchitis is a chronic, superficial infection of the lower airways that usually affects immunocompromised individuals. Invasive aspergillosis involves the sinuses and lungs and may also invade the orbit and base of the skull. Aspergillosis treatment. Patients with primary cutaneous aspergillosis report exposure to a contaminated object. The contaminated object could be soil or vegetation. Hospitalized patients may have arm boards or adhesive tape and occlusive dressings. The diagnosis of cutaneous aspergillosis requires prompt biopsies. These biopsies are then examined with special fungus stains. In addition to identifying the fungus, the patient may need a blood test for diagnosis and treatment. The symptoms of aspergillosis are varied, depending on the form of the disease. They include fever, night sweats, lethargy, unintended weight loss, and coughing up blood. The disease can progress from a mild to a severe stage and cause other symptoms, such as pneumonia. If you notice these symptoms, you should seek medical treatment as soon as possible. A doctor may prescribe an oral medication or prescribe an antifungal drug to fight off the infection. If left untreated, Aspergillosis can spread to other parts of the body. In cases where the infection has spread to the lungs, Aspergillus can invade the sinuses. When Aspergillus gets in these areas, it can cause a bloody cough. The disease may also result in bone loss in the facial bones. Aspergillosis treatment should target the fungus and help the patient get back to normal. Thank you for watching. Please like, comment, and subscribe for more.